When you leave the hospital and are going home right after your knee replacement, we want that home to be safe and as comfortable for you as it can be as you participate in your rehabilitation. Most of the home health agencies will offer a walkthrough. Well, they'll look at the rugs on the floor. They'll help analyze things with you, see if you need some grab bars. I think that is definitely worth doing.
We're pleased to introduce you to Zion's Way Home Health. Our team of professionals is privileged to be your home health provider before, during, and after your operation. We work closely with you and with Dr. Perry to achieve a successful operation and a safe and speedy recovery at home. Here's a preview of what you can expect from us as you prepare for your operation and a safe recovery at home.
Hi, my name's Cameron and I'm a home health physical therapist. Today I want to show you a few simple exercises you can do before your surgery that is going to help make your recovery a little bit easier after your surgery. Now the first exercise we want to do is actually for your arms. The reason we want to do this is because you're going to be walking with a walker after your surgery, and this is going to help get your arms ready for that. So to do this you need a chair, sturdy chair that has armrest, and so I'm going to have you go ahead and sit in the chair and scoot your rear end forward just a little bit, and then with your arms on the armrest you want to press up until your elbows are straight, and then lower yourself down but not let your rear end touch the chair, and then come back up. This is going to strengthen specifically the back of your arms. It's going to help take some weight off your knee when you're walking with that walker. Good. The next exercise we're going to do is actually called a leg extension or a long arc quad. It's going to work on strengthening your quadricep muscles, and they're going to help you be able to get up and down out of a chair, lift your leg, those kinds of things after surgery. So for this exercise, you just want to, if you're sitting here, you want to straighten your leg out all the way, get that quad muscle nice and tight, and hold that for about 5 seconds, and then relax. Good. And then go ahead and come back up nice and tight for 1, 2, 3, 4, 5, and relax, just like that. All right, the next 4 exercises we're gonna do, you can actually do lying down or in a long sitting position. And again, they're gonna work on your strength and range of motion before your surgery. So the next one is a really simple ankle pump, or sometimes we call it the gas pedal exercise. But all you're gonna do is you're gonna bring your toe up and then press down like that, back and forth. This exercise is going to be really important for circulation, especially post-operatively. Next exercise we're going to do is one that also works on that quadricep muscle like we mentioned before. To do this one, you can get a pillow or even a simple towel roll works, but you just want to bend your knees, slide the pillow underneath the legs, and then in this position, if this is a knee we're working on, you want to press your knee down into the pillow and lift your heel up off of the bed and hold that again for 5 seconds. Nice and tight, you should feel that pulling through your quadricep. Okay, so let's do one more of those, and again, hold for a count of 5, and then relax. Perfect, okay? Now I'm gonna remove the pillow here. The next exercise is more for your range of motion, your flexion or your bend. So this is just a simple heel slide. When I say heel slide, I just mean we're going to be sliding your heel on the bed up towards your bottom. So go ahead and slide the leg up and then back down. Now, if your knee is very painful to do this or really stiff, one little trick you can try is to get a towel and just slip this underneath your knee and go ahead and hold it with both hands. There you go. And then as you do the heel slide, go ahead and use your hands just to help bend your knee a little bit. Now with this exercise, you don't want to force into a lot of pain, especially if you feel any sharp pain or catching or anything that's really painful. But using the towel roll should help you be able to get a little bit more motion if you are stiff. All right, the last exercise that we're going to do, I'm going to remove the towel. And this is just a simple straight leg raise. So the best form for this one is go ahead and bend your other knee up. So go ahead and bend your leg up so your foot's on the bed. And then with this leg, we're gonna tighten your thigh muscles and we're gonna lift the leg straight up and then back down. Good. With this one, you don't need to hold, just a slow and controlled motion on the way up and a slow and controlled motion on the way down. This one's going to really help be able to get in and out of bed when you get home after your surgery. Another thing we provide for you before your surgery is an in-home safety assessment where a therapist will come out and meet with you and go through some things in your home that you may not have thought about. For example, your bathroom. How are your toilet seat heights? Do you need grab bars? Things like that. As a therapist, we can go through those things for you and make your life a little bit easier transitioning from the hospital back to home. Just wanted to go over real quick what to expect physical therapy wise after your surgery. Typically we'll see you 3 times a week for 2 weeks. At that point you'll have your follow-up visit with Dr. Perry's office, and then traditionally transition to outpatient physical therapy for a little more care. However, when you're on home health, there are 3 main things we're going to be working on. Number 1 is your safety. Are you able to get around your house okay? Can you get in and out of the car safely, on and off of the toilet, those kinds of things. The second thing we're going to work on is your range of motion. Now this little guy you'll become familiar with, it's called a goniometer, but this is how we measure your motion following a surgery. So your goals are to get your knee all the way straight, so that's 0 degrees. And then as far as the bending or the flexion goes, we want you to get to all the way up to 120 degrees. So those kind of give you an idea of what to shoot for after. The third thing we're going to work on is your strength. We want especially that quadricep or your thigh muscle here. We want that to be nice and strong so you're able to lift your leg to get in and out of bed, as well as stand up off of the chair.
Hi, I'm Gina. I'm a registered nurse with Zion's Way Home Health. I'm here to talk to you a little bit about the services that nursing will provide. A nurse will be out to see you the day after you get home from the hospital. One important aspect of what the nursing services will provide is incision site care. We will be discussing what to watch for signs and symptoms of infection or other complications. So one important thing to remember is to get a few dressing changes when you leave the hospital. This will give you the ability to take a shower when you get home. So you'll just take the dressing out of the package here, and you'll notice it has 2 sides to it. One side's going to be sticky. You'll have to pull off the back of this to get to the adhesive side. So just pull this off and make sure that this strip here is just over the incision site. Now when it's on your knee, you need to make sure that your knee is bent slightly when you put this dressing on. Otherwise, if your knee is extended and you put the dressing on, then when you go to bend it, you won't have any place for movement. So make sure that your knee is bent slightly, and make sure that you pull it nice and tight over the incision site. And there will be a little bit of bubbles. You can just kind of smooth them out as you go. And then once you get to this point, there is a top tab here that you can pull, and you just kind of go around the edges, smooth it out, and make sure it's down flat. Just like that. And usually we change these every couple of days. It'll probably depend on how much drainage you have and the recommendations from your doctor. Another thing we'll talk about is your medications. This could be new medications, antibiotics, pain medications, or any other medications that you may have questions about. A goal that we will have with you and your doctor is to control your pain. So we will work with your doctor on ensuring that your pain management is satisfactory to you.
We hope this information has been helpful, and we wish you the best in your recovery.